Aproko Doctor, what should do the suspect challenge?
Oh yeah, now let's start. Suspect wants a glowing skin.
Run now. Running is part of it.
No,
Yes.
I ran this morning. As a matter of fact, suspects wants a flat belly, but we never do exercise. Suspects wants a glowing skin, but they are always drinking sugary things and not drinking water. I don't know if you're waiting for a miracle. Suspects claims that they are eating healthy, but they will always eat shawarma with 2 hot dogs every day. Suspect claims that health insurance is expensive, but every weekend they are buying ashrebi. Suspect is currently sitting on the toilet seat pressing their phone. They've been there for 1 hour. The suspect will soon have pie. Everybody should stay in their lane. Today on the topic is skin beauty technicians or estheticians. These people are doing a wonderful work by making people more beautiful. You know, facials, etc. But why are you people exactly prescribing medication? Because people come to your place and then you're prescribing retinoids for them. I'm coming for you. It's not your job as a skin beauty technician, if you're not a dermatologist or a doctor at least, to prescribe certain drugs for certain people. Some of you are prescribing steroids. Some of you are prescribing retinoids. Some of you are prescribing antibiotics for people with certain conditions. When they come to your place with certain conditions, please refer them to a dermatologist. Just stay in your lane.
You know what federal offense means?
Because you're causing trouble for actual people. Somebody now saying, why are you destroying other people's business? I'm not destroying other people's business. I'm coming here to keep actual people safe. Because for you to actually prescribe a drug, you need to be aware of the drug. You need to be aware of the pharmacodynamics. You need to be aware of the pharmacokinetics. You need to be aware of the interactions. You need to be aware of the contraindications. You need to be aware of the side effects. There are too many things that you need to be aware of that you don't just think, pimple here, steroid. No. So please, so that all of us will live in peace and harmony, stay in your lane. And if you are collecting drug, medication from somebody who is not a doctor, I don't even know what to tell you. Now let's go back to the mechanic kitchen. Some of you are checking your blood pressure anyhow. And that's why you keep getting nonsense values. Because if you do anyhow, you're gonna see anyhow. Here's the proper way to actually check your blood pressure so that Obarambalielu will not continue to do you. Number 1. Make sure you are rested. It's not when you have climbed 7,000 steps, you are staying on the 17th floor, you have climbed all the staircases, immediately just sit down and check your blood pressure. Your value is going to be high.
Just relax.
What you're going to do is that you're going to rest for at least 10 minutes before actually checking your blood pressure. Number 2, you do not check your blood pressure like this or check your blood pressure like no. You make sure that you are seated properly, legs planted on the floor, and then you sit down. Number 3, your hand is not like this or your hand like this. That's not to check your blood pressure. Make sure that your hand is resting properly on a table this size, and most importantly, the cuff is the proper size, because if a cuff is too small, it might give you a high reading. If the cuff is too big for your hand, it might give you a low reading. Make sure that this cuff is at the level of your heart. And then while your blood pressure is being checked, sure, you know that if you stop smoking now, like now as you're watching this video,
Smoke that ganja until I go blind.
within 20 minutes, your blood pressure and your heart rate will start to drop to normal. If you extend it for like 12 hours, the carbon monoxide level in your blood drops to normal. If you extend it for like 2 weeks or 3 months of quitting, what happens? Your circulation will start improving and even your lungs will start to perform better. If you extend it to 9 months of quitting, that shortness of breath will decrease. Your lungs and your airway will become able to handle mucus better. You can even clean your lungs and reduce the risk of infection. If you extend it to 1 year, your risk of heart attack, that's coronary heart disease, will be half the risk of somebody who is still smoking. And then your heart attack risk will drop. If you extend it to 5 years, your risk of mouth cancer, throat cancer, esophagus cancer, bladder cancer will be reduced by half. Somebody who is still smoking. As the woman said, cervical cancer will be reduced to that of a non-smoker.
Jesus is Lord!
If you extend it to 10 years, your risk of dying from lung cancer will be about half of somebody who is still smoking. If you extend it to 15 years, your risk of heart disease will now be the same as with that of somebody that is not smoking. So the best time to stop smoking is now, not tomorrow. You are not a damn fool.